A new study is shining light on the amount of sodium Americans eat. Number one risk for a diet-related death, sodium.
Yep. According to data published by the medical journal The Lancet, eating a lot of sodium increases our risk for chronic diseases. In an article in Good Housekeeping, they break it all down. How to know just when the salt that you're eating is too much and what you can do to actually lower your salt intake. So Jackie London is the author of that article, as well as Good Housekeeping's nutrition director and a registered dietitian. Thanks for joining us.
Hi.
Thanks for having me. Good morning.
So we were just talking. I think we've been hearing about the problem with sodium forever.
For years.
Are people not getting the message?
I think that a lot of the problem with our sodium intake, especially in the U.S., is that we don't have sufficient education in terms of where the salt in our food actually comes from. 70% of the salt that we eat comes from processed and packaged foods, not from the salt shaker. That's really a negligible amount, and the sodium that's found naturally in foods also contributes less than 11% to our total daily intake. So where are we really getting it from? Breads, crackers, cookies, baked goods, cereal.
Bread. When I bite into a slice of bread, I don't think, salty.
Well, here's the thing. It really adds up. So when it comes to looking for products and looking for food products and shopping the supermarket in a way that's more healthful, when you're looking at salt specifically, you want to look for 140 milligrams or less of sodium per serving. So where we get into trouble is that with breads, some of them can be up to 230 per slice. So the problem with sodium is not that any one food or any single food or nutrient in isolation can really make or break your state of health, right? But it really is that these things, they add up incrementally, and they inevitably make a larger impact to your daily intake, especially if you're eating consistent intake of processed meats, which a lot of us do without even really realizing it, because it's in a lot of fast food items as well.
The one thing that I've noticed about, and I, you know, we talk about this all the time because we're all very interested in sort of these issues. You know, I cook a lot at home. I don't eat a lot of processed foods, but I try not to add a lot of salt, and then you say it's negligible, but then when I sometimes get on the scale in the morning and I'm feeling a little chubby from the water intake, and I try to drink like a gallon, but it doesn't help.
Well, here's the thing. The one thing that I love the most about this study specifically is that they highlight some areas where we could all do better, and one of those is to eat foods that are higher in potassium, magnesium, and calcium. Now, this study doesn't specifically go into that, but they do highlight that we're not eating enough whole grains and we're not eating enough fruit. Now, where you would find those items in terms of adding more produce to your day and adding more 100% whole grains, that's where we can make the biggest impact, is to think about what we can do instead of what we have to take out. I usually like to think more in terms of inclusive diets rather than exclusive diets, because the more we're told we can't eat something, the more we get tripped up and caught up in the numbers. And really the idea is to fill up on produce, make at least 50% of your meal produce based. So veggies, fruit, anything, whole grains, pulses, lentils, chickpeas,
that can reduce the amount, like if you're taking in a little too much sodium, that can help offset the...
Yes, because the counterbalance to sodium in your body is potassium specifically, but calcium and magnesium also play a role. So the electrolyte balance in your bloodstream is going to be offset by having foods that are higher in these sources of nutrients.
That makes a lot of sense. Of course, it's best just not to ingest as much sodium. But listen, you know, so the Lancet said that eating too much salt is a leading dietary risk of death. I think when people hear that, they go, well, aren't we all going to die of something? I mean, geez, I mean, what does that mean?
So high blood pressure is called the silent killer. The American Heart Association has tons of literature that supports this as well, which is that when you have high blood pressure, there are no symptoms. We don't walk around thinking, gosh, my blood pressure is really high. Most of the time. I mean, white coat syndrome is certainly the exception when we walk into the doctor's office. But when it comes to making sure that you are meeting your requirements and staying within what's healthy for you, what's normal for you, that's where you really are going to have to check with your physician. You're going to have to make regular appointments, and you may want to be regularly checking your blood pressure. But it is amazing that diet can have such a profound impact on something that is so immediate. So if you're walking around with high blood pressure, you know, especially, it's the leading cause of death for women in the U.S. So it's incredible to think that we have a lot of power in terms of our own state of health when you think that both diet and knowing our own risk factors and our family history are the two most important variables for offsetting any risk of disease.
And high blood pressure could lead to what? A stroke?
High blood pressure leads to various chronic diseases, but all of them are cardiac related in some form. So they will affect not getting enough when your blood pressure is high. It's essentially that your blood flow through your body's blood vessels is impaired, which means that you're ultimately not going to be oxygenating all of your body's tissues as well. It can lead to organ damage, and it can also lead to stroke, risk of heart attack, and various risks of other chronic diseases related to organ failure.
It's really important information, and I think, you know, what people need to understand is when you talk about processed foods, you're basically talking about, for example, deli meats, and now when you add on the bread, you think you're eating a healthy turkey sandwich, and in fact, you put a little mustard and, you know, all that other stuff. Next thing you know, you've got a big sodium bomb in your mouth.
That's right. The condiments also really add up. So read labels 140 milligrams or less. 480 milligrams, that's way too high. So stay under that range per meal, and we're in good shape.
Good advice. Jackie London, thank you so much. Really great having you. Thank you.